Welcome, everyone. We are about to start in few minutes. I appreciate your patience. Meanwhile, if you can go to the Q&A and tell me if you are a parent or a professional, because I don't think the chat is activated. Thank you. Or you can unmute, whichever is easy for you. But I do appreciate anyone who can tell me. Thank you, Andrea. If you are a parent, so I can gauge the presentation based on my audience. Thank you.
Hi, good morning, Zubida. This is Stephanie from Valora Centers. Nice to see
Hi.
you.
Thank you for being here.
Yeah, of course. I told you I'm ready to collab and just making sure how we can work.
Thank you so very much for being here.
Of
Appreciate you.
course.
We have about 1 minute and we will start because I have a very good information to share today. Welcome, everyone. I appreciate each one of you today on this wonderful, sunny, mild weather day, if I can say that, in Chicago. We still kind of spring. I can take a little rain, but not too much cold. I'm tired of the cold, though. I am Zubida Pasha, the educational support coach at Family Matters. I am also a parent of an adult with IDD. I have been around the Parent Training Information Center work for a long time since my daughter was an infant, if I can say that, transitioning to early childhood. And I found myself really much liking this field because I feel I have been helped and I am passing on that baton of support to other parent, community partners, disability allies, and so forth. I see so many names that make me smile today. I welcome each one of you. It's very good to have you here today. What is a Parent Training Information Center? Parent Training Information Center is a program that is funded through the U.S. Department of Education Office of Special Education Program. What we do is support, empower, educate, inform parents. We are not a legal agency. We do not provide any legal advice for parents. We are unauthorized to practice law. When I talk to parents or professionals, I definitely do not say pursuant to IDEA, but I say sometimes based on IDEA. I kind of hone in on free appropriate public education more or less, but I do not use that legal language. We are the only center in Illinois. It used to be two, but now we are covering the entire state, and we are doing our very best to make sure we meet parent where they are, professional where they are, and kind of fulfilling the need of those who need the information and the resource. The content of this presentation, it is developed under the grant we are under, but it should not be perceived that is endorsed by the federal government. And again, we are not a legal agency. We can refer you to legal agencies who can help you with any legal matters, but we do not get involved in any legal dealings at any level whatsoever. We provide advice. we provide support, guidance, and I all the time emphasize consider, because we don't make decisions for parent. So today's topic is all about tracking and the progress that your child is making towards their goal in the IEP. We are going to cover in this presentation the practical tools and the rights under IDEA and how to use monitoring data to advocate for your child or for your surrogate child if you are a surrogate. And I see a couple of you here. And I thank you very much for being here today. That these tools will emphasize practicalities, actionable resources, not just theory. We encourage you to take notes and ask questions throughout, or I prefer the parking lot if you don't mind, because I don't want to miss, the content, but I don't want to miss your questions or comment for sure. So what is an IEP? That is the stardom of, first of all, if we are covering this, we have to make sure we understand what is an IEP. An IEP is a legally binding document. It is also a living document, meaning that I can open the IEP at any time as a parent because I am an equal partner if I see something that is not working. So these are really information that you need to keep in mind as you navigate these processes, because sometimes you hear the school, or you have only one time in the year and etc. No, it's not the case. This is not a suggestion or wish list, but the school is legally obligated to provide the services written into the IEP. Also emphasize that parents are equal partner. That's why in the IEP, at any format that I have seen statewide, even nationwide, on a federal platform, I have seen this particular piece that is consistent based on, again, IDEA saying parents are equal partner in the process. You will see a component saying parent concerns. So if you are a parent, if you are a surrogate, someone who is advocating for a kiddo in the school system, make sure you provide your input and your concerns or anything that you have in mind for your child to achieve within that school year. Many parents don't realize they have the right to disagree, ask questions, request change, and also suggestion from parents sometimes is not put in the IEP, which is a problem because, again, parents are equal partner in the process. It is developed by a team, and the team include, of course, the parent, and I add, whenever appropriate, the student, because I come from the mindset of nothing about us without us. We have to really, really kind of focus on the student participation. Why? Because the student need to understand everything in that IEP, because at 14 and a half, they should have a say-so in the IEP. So we have to prepare them as early as possible. IDEA mandate that the progress monitoring should be in the conversation during the IEP and all of those steps. So school assume that it is just not a good practice. Make clear if that the school is not providing regular data based on the progress report. You get the progress report possibly within a quarter or less than a quarter. Of course, you're gonna get also the report card, the IEP report card, depending on where you are in the state. Some schools, they go quarterly, some schools, I got really tangled into the federal platform. Some schools, they go by semester. I have few schools, they do semester, but most of the school in Illinois, they go quarterly. So every quarter you should receive an IEP report card. What does it look like? It will look like that benchmark for that reporting period. And they will, of course, repeat the same thing from the IEP, and they will say making progress or not making progress. That being said, you have to really keep up with your child progress. You can keep up the progress through communication, regular communication with the teacher, visiting the teachers and the school, and really look into the portfolio of the students, which it will tell you the work samples, it will tell you the quizzes, all of those things. Beside, you should receive also a report card that have all of those A's and B's, all of those, marks. So if you see something that is not looking okay, then you really, really have to make sure you ask questions, you meet with the school and ask for an explanation. Whenever there is an issue, ask. They have to respond to your whys. I all the time say this, and I think some of you who attended previous trainings define the why. We need to ask those questions and have an explanation that is reasonable. IEPs must describe how the child progress towards their annual goal will be measured. This is not, again, a best practice. This is a mandate. Sometimes the school, they just put charting or list or portfolio. If you need more explanation, that is the time during the IEP to say, I would like to have the portfolio sent home every other week or at least once a month instead of that quarterly. You can go during that report card pickup and in person, that's not a bad thing. But if you really want to see everything on a consistent base, you can set it up in the IEP. School must report progress to parent periodically, and I said possibly quarterly or in a semester, depending on where you are. And that has to be also noted in the IEP that this is going to happen in such time and such day, etc. Keep parent informed. This is not an option. This is not a courtesy, but it is a mandate under IDEA. Why? Because it is through the IEP. And we all seen in the other slide, the IEP is a legally binding document. That means compliance is one of the things that we have to keep in mind. Why progress monitoring is important? It is very important because it will give the parent the gist of where their child is and what they are doing. You need to see that to make sure those grades that they receive are earned. I understand sometimes modified grading scales give you the peace of mind, but I all the time come from that side. What is the real function and performance of a student under the IEP? The accountability piece and the progress monitoring is really, really important, that the services and support outlined in the IEP are actually producing results. Because if you have a goal, SMART goal, it is outcome oriented. And without that monitoring, there is no accountability. So without data, there is no way to confirm that the child is benefiting from the program, the support they're receiving. The other piece of progress monitoring is data driven. When progress stalls or there is stagnation, monitoring data provide a clear, objective basis for adjusting goals, supports, and services. Let's say a child who is not really doing well in math, particular math goal, and you don't see the progress at home. You are sitting with your child, you're doing the homework, and you don't see them, pulling or understanding the concept, etc. You go back to that IEP and you look at that goal that they are working on. You have to immediately make it known that the child, while you are doing, the homework and helping them, you are not seeing, they are making that expected progress. I'm not saying week 1 or week 2. You have to give it a bit of time after the meeting. Let's say you met with the team in February. By mid-March, you see a stagnation or there is no progress. You have to call a meeting and make the changes that must be, helping the child to progress towards those skill building and whatnot. Meaningful communication is critically important in progress monitoring. It will help the parent to have that line of communication and information directly from the providers, teachers, and of course support staff, service providers within the school, such as speech therapists, behavioral therapists, etc. This is really important. This is just, again, not a courtesy, but a mandate, because, again, we fall under that IDEA parent are equal partner in the process. Then the legal mandate of the IEP as a legally binding document, it gives you all of these leverages of making sure you are monitoring the progress of your child or your student with the team within the school. The legal requirement under IDEA, it encourages parents to pull out their child current IEP and look for these two elements. Can they find specific measurement method for each goal? You have to really look if there is the measurement method. Can they find reporting schedule? There is not only the method of the reporting, but the schedule is also important. And again, why? Because the goals that we are monitoring should be timed. So goals should be SMART, specific, measurable, attainable, realistic, and time-bound. If that not an action item, the warning call out an intentional, and this is a compliance issue. And again, we don't get involved into the compliance and what does it look like, but we keep emphasizing the legal mandate of IDEA, which basically I focus on that free appropriate public education provision, meeting the children's needs and help them to access their education environment successfully. If the child IEP does not include both of these elements, it may not be compliance with federal law. You have to really, again, call that meeting and address this, because the language have to be clear how the measurement should look like. And again, the time on that benchmark or that goal. Choosing the right measurement tool. This is sometimes hard. Why? Because as parents, we're not educators, but we are educated on our children needs. So we know what will work and what would not work. We already kind of understand how our children will navigate these aspects. So the measurement tool is the backbone of the monitoring plan. A mismatch tool, let's say if you are talking about reading and you are going to do something different than the curriculum-based measurement, that is not a good tool. That's not the appropriate tool. One that measures something adjacent to the goal rather than the goal itself. Producing data, you have to have a tool that gives you data, because again, in progress monitoring, everything is data-driven. Well, in special education as a whole, everything is data-driven. The goal, for example, if it is reading fluency, what it looks like. Reading aloud, the number of the words per minute, then there is that measurement of 95% of accuracy. The measurement tool here is the oral reading fluency, the ORF assessment administered weekly. So we can see how many minutes the student is reading and what is the accuracy of the reading. So we are here looking into the reading component only for the fluency, which is the speed of how many words per minute. Then we are going to use this tool every week to test the student. If they are going from, let's say we're starting at 75 the first week, next week we are 78%, then we are going to 80. That is good. That is meaning that the student is making progress. If the student starting the goal in February, I'm gonna stick with the February timeline. By May, by now, the student is still at that 70, 75. 3 months, we didn't make any progress. Something is not okay in the support provided for the student. Another example of social skills. If a student is in need of SEL, social emotional learning, then we are going to teach them how to interact with peers. We have to give them the opportunity to be mingled with peers 3 times out of 5 school days. Then we have to count the frequency. Then we have to really look at how the student will interact. Now, this will require an observation. There is no assessment tool here but observation. So I have to put my eye on that student, and I have to track how many times they looked when a student would appear is talking. If there is an activity, a tabletop activity, is that student engaged with their peers? Are they giving and taking, let's say, crayons or work tools, whatever they are? In other words, that interaction, that will require only observation. This can be a little bit kind of hard to track with the teachers, because sometimes if they are not there and you have a sub and they did not report, that's a problem. So that's why make sure everything in the IEP, because even though they have a sub, the obligation of the school, not the sub only, the school as a whole, as a system, is to provide that information and that data to you as a parent. Written expression. This is another kind of example of goal. Write 5-sentence paragraph with correct punctuation 80% of the time. Here, our data collection will be work sample, and we will look if the student is starting with, capitalization. Are they putting the punctuation properly, like the commas and the dots and all of those things? Then we have to create a rubric so we can measure the progress pertaining to this goal. You see here 3 measurement tools. There is the direct observation and the charting, which is going to be like a check mark on a list, or an assessment tool such as the oral reading fluency assessment, because the teacher may have, that available. If not, they have to talk, to their administrators to find what tools they can use for reading, assessment. Then you have the work samples. When the student is producing, the writing, then we have to look at what they have done in terms of that skill. So what is not to use in progress monitoring is subjectivity. Not all data is created equal. We have seen here, we have 3 measurement tools, and we have seen one of them is observation. And the example of a sub, it had happened in one of my caseloads. They did not have a permanent teacher and they have subs. Every day they may get a sub, and the parent got flustered because she didn't have anything at all to prove for, herself to say, okay, well, this is not what I'm looking for. I am looking for something substantial and really something that I can see to base my observation on my child, what they are doing the work at home. And that was really just kind of like unnecessary, if I can say that, head bumping, because the principal, he says, I don't have staff to do that. Your child is doing well. They are attending every day. She says, I understand attendance, but I also want my child to see what they are doing in the school. So here, when we talk about subjectivity, it can become a little bit of a sensitive topic. We are not pinpointing to nobody here. We are not accusing teachers or schools for, dishonesty, but we just kind of pointing that subjectivity are not reliable tools for measuring specific skills. We have to kind of frame things in a positive manner. We have to really put the emphasis on data. It removes really confusion and make conversation more productive and less personal, if I can say that. Establishing a baseline, and sometimes this is hard for parents to understand why. Baseline data really have to be very clear in the IEP. Without this baseline data, I don't think we will have a lot of understanding of progress monitoring on its own. So the baseline, it is often overlooked but it is very important, if I can say even critically important in this process. Without this, which is the baseline, information, we cannot measure growth. Baseline is where the student is now. Let's say we have done our IEP meeting in February. At that time, the baseline should tell you where that student is in February. What are they able to do on their own? And what are they able to do with support? So that is kind of a raw information that we need to take, because based on that information, we will detect the gap between the school, of course, grade, and of course, the instructional level and the grade level. If the student is in 5th grade and the baseline information is telling us that that student is in 3rd grade, we know there are 2 grade difference. So what are we supposed to do is to really bridge those gaps with the goals and to teach the skills for the student to kind of keep progressing and learning the skill to come up to those grade levels. It's not going to happen again within a year or 2. I have seen that even my daughter, who have this comprehension to today as an adult, it does not get bridged very quickly, but it is an ongoing process where we have to continue supporting our student with what is necessary. Do you know what your child baseline when you have the IEP? You really have to look for that information. If you don't, you have to look for that information in the IEP. If you don't see it, that's a problem. You have to ask the team to clarify that in writing in the IEP, because that's the present level. I call that the PLAF, the present level of performance in the IEP. Without that information, again, we are not going to have goals. We will not even have a conversation about progress monitoring. Creating a graph for clarity. Sometimes I am really kind of a visual person. I would like to see graphs. I would like to see numbers. And specifically, I would like to see, I'm sorry, I am pausing because I am admitting people who may have been kicked by the internet or something. I like to see kind of percentage. They work better for me than, numbers work better for me. So line graphs make progress accessible for educators, parents, and students, but sometimes those graphs can be confusing for parents. Please ask the question. If you see a graph, ask, what does this mean? What is this for? Why? Because it will give you an idea what those axes and the vertical, the horizontal, the baseline point, the goal line, all of those things will be explained to you by the professional who have, created those graphs. This shift conversation from opinion to evidence. Now we have data, we have evidence. We are not just kind of saying words without backing it up. Then we have to explain to the parent those graphs and what does that mean in words, or however the parent will ask for it. When I used to see something that is not clear, I say, what does that mean? Is she meeting the goal? Can you provide me with a work sample? How did she do it? Did you help her? How much of help did she get to achieve this? So it's a lot of information involved in progress monitoring. You have to ask questions. And again, I go back to defining the whys. Defining the procedure and the schedule. Again, in IEPs, you have to really look at the schedule. And most of the time it's quarter. Consistency is very, very important, is a key word here. If the measurement method changed from the one monitoring period to the next, the data point cannot be compared. And if we cannot compare the data from the baseline to what's happening now, then we are not having a good outcome or good results to understand if the child or the student is making that progress or not. Encourage yourself as a parent, or if you are involved with a student in IEP dealings, is the monitoring procedure and schedule written into the child IEP? You could look for it. If it is not clear to you, take that IEP, say, where can I find this information? Because The IEP is cumbersome. It's a lot of information, a lot of pages, and sometimes it's confusing. Ask that question. Request that to be clear to you as a parent to make sure you have that tool to measure the progress of your child. Many examples, of course, we all the time prefer examples to really help us understand. A well-structured progress graph transforms abstract goal to visible, trackable journeys showing clearly where students started, where they are now, and what they will do later, once we teach them that skill. When shared with families, the graph make the data undeniable and the conversation more collaborative. This is one of the most powerful tools in special education. When you have those graphs, when you have those tables and those type of measuring tools for the student to meet their goals and whatnot. Beyond making progress, specificity is crucial. We have to really make sure the goals are specific. We make sure when we work with parents, we walk them through understanding SMART goal. And we focus and hone in on specific. Why? Because we have to help the parents see correlate between the evaluation results and the goals. Evaluation will give you a lot of information on students' strengths and needs. So once you understand those two items, strengths and need, then you will be specific on how the tools of supports will be provided, how the measurement of the progress will be provided. This one is very important as well, like everything else in the IEP. Parents receive vague report and assume everything is fine until you receive a failing grade, or you will be called like, okay, there is a problem here and we want you to know X, Y, and Z. Or they will change the placement. Let's say if a student was in a resource room with a push-in model, then within a year, you were not notified that the student is doing well. Then the next IEP, they're proposing a change of placement to self-contained. Then I will ask, what happened? I have a case currently where the student was kind of receiving the services in general education and had a paraprofessional for behavioral support and attention. Then the parents were shocked at the IEP. They were going happy and they will discuss, X, Y, and Z. When the child come home and do the homework, of course, she needs support and they support her and everything is going. Until they went to the IEP meeting and they said, well, we are proposing a change of placement. We don't have a self-contained. Here is the list of school that we can propose. So the parent called us and they were confused. It's very important to be very specific when you're talking about IEP goals. And that's exactly the point that was missed with this particular case. And again, this is not one size fits all. But when we miss the mark of conversation clearly and effectively, then of course the outcomes are not too great. You have the right, again, to go as a parent. I used to go every other week to my daughter's teacher and say, can you show me what she did in the classroom? Because you send the homework and I notice without this intensive support, she's not pulling the answers. And I had rejection in the beginning because, oh, you have to wait until report card pickup and I can show you, the portfolio. I said, I'm not going to wait till that time because it's 3 months. I am noticing this within every day. She comes and she's not able to do the homework on her own until I sit next to her and I am pointing with the pencil or pen on the keyword, etc., etc. Oh yeah, we help her and sometimes we highlight and sometimes we do this and I said that's exactly what I am trying to understand so I can kind of replicate these levels of support so there is a consistency, because when you have a child with certain disabilities like my daughter with autism, the consistency and structure is very important for success. Essential component of a progress report. Specific goals are very important. The exact language have to be provided. And of course, we have to make sure that we are just not a phrase, but the measure goal as written in the document. You have to have the measurement method that is outlined also in that goal, and the data, how it will be collected, and then the comparison to the baseline. So when we have parents who call us to understand this aspect, we walk them through each component of that goals that are outlined in the IEP. Then we break it down. Here is the specific information that you need to know. I go back to the information where it says present level. Here is your child, where they are. They are reading, for example, at 3rd grade, but they are in 5th grade, reading and comprehending both. So that's instructional level. So this is very specific. Then the goal should really look like they are going to bridge that reading fluency, where you saw the example we provided here of 115 words per minute. Please forgive me. I am admitting again people who may be kicked out. I'm so sorry. I lost my thought of chain. The goals have to really be based on where the child is at that present level, and then you take it to the next level. You keep in mind that with this progress monitoring, you're looking for skill building for progress. It's in itself, the word progress, they should learn something. They should develop a new skills and learn something, and they should move that needle from the baseline to the next level. If they were reading at 3rd grade, by the end of that IEP timeline, they should move from that 3rd grade to somewhere else, 3rd grade and a half, 4th grade, and if we are lucky, possibly the 5th grade. The timeline or projection, they are also very important. We have to really, really make sure we have the time. The projection is often missing from progress report. And that's a problem again. Every IEP should have a date, and every benchmark should have those dates, also projection. So if you did the IEP in February, then you have the projections of March and then June, if the school, of course, is till June. I'm talking about CPS here indirectly. Then you go to the next year when the school begin in August. That's another benchmark. So here, knowing a child is at 64% now, in December, we need to see if they will be at that 80% as the goal is saying. So now we are on track. If we are under that 80%, then that is not a good thing. We are at risk. If they are really, really not doing any progress, meaning they still at that 65% where they started, they are not on track. And that's, again, an issue. So here we have to make sure, even though it's a lot of numbers, a lot of percentage possibly that you may see in the IEP, ask those questions so you can understand what's going on and how you can help your child progress. Because what is done in school is good, but also we complement that at home with homework or with things that we do. Now, summer is coming. Some students, they are not eligible for ESY. So we have to continue working on, these things until the student, meet that 80%. Explanation of the data, and this is kind of does not really sometimes kind of get easy with the teachers and with the school staff. They use a lot of acronyms. If you hear acronyms you don't understand, please ask the question. The explanation of data sometimes, it's numbers alone does not always tell us the full picture and give us the full picture. A meaningful progress report acknowledges that real children have real circumstances. There are children who may have the absence or disruption due to medical whatever than the weather, school closure, whatever those circumstances that can happen and create disruption, or transition between settings can significantly affect the progress. A note explaining fewer data collection opportunities give parent important context, because here you have to have a context, a background, where you can base your understanding so you can really have a full picture. Change in services. If a service provider changed, a support was added or removed, a new strategy was introduced in the midst or in the middle of that timing, of that benchmarking, school obligation have to inform the parent. So the parent will understand what's going on if they see a shift in their children, a shift that is good and they are picking up and they are doing good, that's not bad. But if I see a shift where my child is stagnant, not progressing, not really grasping the concept, all of those skills, that is a problem. We need to do something about it. Major life changes, health issues, or shifts in the school environment can all affect performance. And ultimately, this can affect, of course, the progress monitoring, where kids, if they were sick and in the hospital, even though they would be provided with the education in the hospital setting, it is not going to amount to where they will receive it in the school. Even under the homebound services, homebound services are only 10% of instructional time. So these are things that you have to keep in mind. If it happened, consider these changes in the explanation of the data, because a change can affect, of course, the performance of the student, but it has to be noted so you can understand why there is no progress, or if there is really major progress, then are we going to move to the next level of skill teaching? Red flags in the progress report. If there is no numbers, no baseline comparison, goal mismatch, late or missing report. These are really red flags. If you see no numbers, just saying meeting expectation or progressing as expected, and I don't have any numbers, any charting, any percentage, that is a problem. If there is no reference to where the student started, then that's another red flag, because again, baseline is critically important. That's the present level. You start there, and then you will measure where your child is heading. Goal mismatch. Sometimes the report describes a skill that does not match the measurable goal written in the IEP. So we're talking about reading, fluency, but the reporting is talking about writing paragraphs. So that is not matching what we are teaching the child here or the student. Late or missing report. I have seen this pattern in some schools when I was with the other organization in the Chicagoland, where schools did not provide any report, not progress report, not report card, nothing. And they said, oh, they are doing fine. They're attending. They are happy. Everything is going. Well, show me. I need to see some data. That is also a red flag. So if you don't have anything that you can see, you can read, you can measure, that is not a good thing. So we have to be really making the effort to communicate, again, on a constant base with the school to show us what is done, how is it done, and where are we heading with what is done. You see here, I'm saying too many words, but I am correlating each piece of these words to the other. If the progress monitoring that we are dealing with is vague and not really specific, again, we talked about specific. It's very important that we have to be specific in reporting and in making sure we understanding what are we doing here. It is very, very empowering to understand everything that is in the IEP. Many parents feel like they should be grateful for whatever information they receive. I am, but I need it to be backed with the data. IDEA give you the leverage as a parent and an equal partner in the process the right to ask questions, the right to understand, the right to collaborate for the child, progress sake. Exercising these rights are very important. This is not adversarial advocacy act, but it is a partnership and collaboration. It is very, very important to be really responsible for asking those questions. No one else will do it, even though you will call us, parent training information center staff. We don't call the schools. We don't get engaged in talking to the school at any level when we work with parent. We do a record review. I ask the parent, do you have the IEP? Share it with us, etc. If they don't, then find the IEP, send it to us. This is very important. We encourage you as a parent, if you see something that is vague, ask, what does that mean? How is it done? They are making good progress in math. Well, show me their work sample, show me the method that you are teaching them how to make that progress, to reach that progress. If not, that is not measurable to me. Really, it's not. Here is a measurable goal. We are really starting at 40% in September. Currently, they are 65%. So here I have 25% increase. So that means we are doing okay. The target is 80% by June. So they are on track. The student is on track. So starting at 40, we are at 65. The target is 80. So we are now September. By June of next year, school year, we have to really hit that 80. Now we are talking about numbers, specific numbers, and we are also looking at the time here, September and December and June. So we have specific information here. This report gives the parent everything they need to understand where the child is and where they're going. So this is what progress monitoring means, where they are now and where they are heading. You are an equal partner in the process, and you are an IEP team member, so you have a say-so. Keeping record is very important, not only for the progress monitoring, but for everything that happened in the IEP itself. So I don't take anything kind of for granted. I want every information so I can keep up with my child progress. And I all the time start my emails or my letters as an equal partner in the process to kind of keep reminding the team, the other team members, that I am requesting this because I am a team member and I have the right to see it and understand it. You have the right to receive specific measurable progress report. If report don't include actual data or clear connection to the IEP goal, request more detailed information in writing. Report must be on time. They can be late by a day. You can understand sometimes people, they get overwhelmed, but weeks and months, that's not acceptable. Why? Because we have to keep everything specific and timely for compliance. Document the gaps. Contact the teachers and the service providers to understand what is going on here if you see gaps in information, in progress, and all of the above. Keeping your own record. It's very important when you are working with your child at home. Sometimes I went to the extreme where I had videotaped my daughter in the event when she was really having a difficult time with certain skill building, like comprehension was the hardest, like comprehending a text, translating that comprehension to her own word and put it in writing was very hard. So they used to say, oh, she's doing it. We give her the graphic organizer. I say, I give her the graphic organizers, but she is not doing it on her own. She all the time rely on a verbal prompt, a visual prompt, and even starting the sentences for her and the correlation between the ideas. Let's say you give her 2 pages to read and there are 2 ideas, then she's just honing in on one, and to kind of correlate it to the other one was very hard. And they keep saying, oh, with graphic organizer and sentence started, she's doing it. I said, I don't see that here. So I used to keep my own record, including videos. And they used to kind of like, okay, here she comes. I was like, I want you to see this. She's whining, she's screaming, she's not happy. She just want to do. the bare minimum. And I get it. Sometimes kids, they get very tired, but 6th, 7th, and 9th grade, 10th grade, they have to have the stamina for study, skills and whatnot. And at that time, it was very hard, especially the comprehension and the producing of writing from her head. So the follow-up emails, especially valuable. You have to follow up in writing. It does not need to be formal. You can put it in your own words. Just be clear on what you're saying, what you're trying to do, and what you're looking for. Just want to confirm that we discussed today, for example, bullet point. I don't do even a narrative. I used to just go with bullet point with the school so they can see exactly what I am trying. And sometimes I just say, this is the keyword of our discussion. And next, meeting, we will focus on this keyword. Create a paper trail is very important for your own sake so you can understand what's going on and you can present it. People, again, in the school system, they can change positions, they can quit and have subs. Will the sub look at the record? I don't know. I can say yes or no. But if you have a sub coming into March and everything is going in March, the INR, the testing, the this and the requirement, it's hard to keep up with everything. You keep the record. You have that under your hand and you can share it with the educators. Again, under the partnership umbrella, I would say share it with the educators who are directly providing services to your child to make sure you are progress monitoring appropriately and collaboratively. What to track yourself? The baseline, the performance, and the target criterion, the current data point, and of course, the report date. What this means, the baseline is the performance before the services began. Why this is important? Because this is the starting point. This is really the foundation. You cannot measure the real growth without this information. The target criterion is the specific end of year goal performance, like the 80%, the 85, the 95%, etc. This will help you judge whether the current progress is sufficient or not. Let's say the example, I'm going to shuffle back to that example where we had the 40% baseline, then the criterion, we have 80% by June, but we are at 65% in December. So we know we are on the good trajectory here to hit that 80% by June. So this is what it means, the criterion, target criterion. The current data point, actual number from each monitoring period. If the skill teaching is happening every day, you should see something every day. It revealed the trend and improve really the plateauing or declining. Sometimes kids, they have, that plateau where there is a stagnation. But if I see a cliff, that I call it the cliff, a decline, that's a problem. If I see the curve going a little bit up, even though it is smidgen slowly, I take that because it's a progress. We're going up. The reporting dates, and again, the timing here in progress monitoring is as important as everything we're talking about. Why? Because without the timing, we will not know if the progress is happening or not. So this is just not something that is courtesy, but it is compliance with IDEA reporting requirement. When to question and have a discussion, it's really important to have these conversations. As a parent, you have the right to agree or disagree. Many parents worry about being seen as difficult or adversarial. I'm a parent. I'm going to wear that hat at heart and advocate. I want my daughter to progress, and I have high expectations. Frame that however it is going to make you feel comfortable. But at the end of the day, the student cannot advocate for themselves, especially if they are in early elementary or middle school or even high school. Some of them, they can't. They are afraid, they are anxious, don't know how. Who knows, depending on the disability and where they are. But you have to ask questions. Be clear when you are asking the questions about the report, about the data. make sure you understand what you're looking for first, because sometimes there is a lot of information in that IEP and it confuses you, and then your question may confuse the educators. I would take that IEP and I was like, I'm reading this page and it says such. Is this is going well or not? Can you tell me how is it done? And can you show me any paper that you are doing here with my child? The school job is to respond to those concerns, and IDEA give you that leverage again as an equal partner to ask those questions because you are part of the process. If the data trend has been flat or declining for several monitoring periods, the current approach may not be working. The supports and the levels of support have to be rediscussed. So we have to have a revision to this. And we have to sit as a team to discuss what this is not working. Then we have to discuss what will work for this student. Insufficient progress towards the goal. If it becomes clear mid-year that your child is not meeting the annual goal at the current rate, then you have the right to request an IEP meeting to discuss the annual review before it's time. If you have the anniversary of reviewing the IEP in May, but by February you are seeing there is a stagnation or a decline or no progress at all, I will call a meeting at that time. And again, I had started the presentation by saying that the IEP is a living document. You can open the IEP at any time of the year. The power of objective measuring. We all the time kind of emphasize being objective. It is very helpful because it really helped the parent to steer away from personal conversation, subjectivity, and all of that. Everything should be data driven. I am going to have like a smile or icebreaker with a joke, but I will go back to business and say, can you show me information in numbers or graphs or whatever that look like, whatever works for me, and what works for me, numbers and graphs and percentages. Why numbers matter? Because they are objective. They are not going to be, kind of created. It will be earned, of course, and they will have to show you how the student had earned, that number. Parents who come to the IEP meeting with data are taken more seriously. I have seen that. I have noticed that throughout my number of years in doing this business. Not because they are more aggressive, but because they are speaking the same language as the educators. Because the educators speaking data, then you're speaking data, then you have that commonality and that really understanding right there. We encourage parents to understand the IEP, and that's why we are here to help really dissect the IEP for parent. We encourage you to contact us if you need that record review. If you don't understand something pertaining to a particular questions, go back to the educators. And again, we are here to navigate those records with you and kind of give you some guidance and some explanation, or some things just sometimes just ideas how to ask. Because if the educators saying, oh, we don't have an issue, we don't see that here, etc., then you have, something to work with. Collaboration in progress monitoring is very important. I cannot emphasize the partnership in this process or in the IEP process as a whole, and including, of course, the progress monitoring. Takeaways: be informed, be specific when you ask questions, be proactive, and collaborate. Keep it in writing. You have resources that we will share with you, and there is a survey that I'm gonna launch. I don't know if you can see it. I'm hoping that you can see it, but if you don't, I will send you the survey. We will rely on your feedback to do better. And now I am open to questions if you have any. I am going to the Q&A. I don't see any. You can unmute and ask your question. We have about 3 minutes. Do you see the survey? Can someone tell me yes or no, please?
the chat was disabled. So
Yeah, because it's, let me put that in the Q&A. I don't know if you can see it in the answer. Okay. Let me see if I can get this, because it's a webinar. Oh, you see the survey. Julie, she sees the survey.
yes,
Okay.
we can see the survey.
Okay, good. Very good. Someone said you don't see the survey. I'm gonna launch it again, just in case. Depending on the device, if you are on the phone and sometimes too many things open, you may not see it. Any questions or comments? Okay, I don't see anything in, let me see if there is any question. Okay, there is a question. Child 3 years, a level 3 autism is not making any progress on goals. What can I do? You have to go back to the table, discuss what that specific goals that they are not meeting. I am thinking that the whole goal set in the IEP is not met, then you may have to revamp the method of support and the levels of support that the child is receiving. If you would like, I'm gonna type an answer for you with my email address and we can chat about this. Tell me if you see my email. Okay. Any other questions or concerns? Okay. It is 1 o'clock. I cannot thank you enough for being here and staying engaged. If you have any further questions, I will send you the PowerPoint, the survey, and a couple of links for you to contact us through appointment and our calendar for the summer if you would like to stay engaged in the summer series and discussion. You have a good day and thank you for being here. Have a good day.
Thank you.
You're welcome. Thank you for being here.